Então eu queria começar chamando o Dr. Salas, do México, para falar sobre endoscopia nasal, fatos e mitos. Dr. Salas.
Bom dia. Good morning to everyone. I'd like to thank Dr. Sam and his committee because this is an excellent congress. Well, I'm going to talk about nasal endoscopy, facts and myths. We did, okay, something happened. Okay, we did a worldwide nasal endoscopy survey between 100 ENT otolaryngologists that they perform nasal endoscopy and 25 experts in endoscopic sinus or skull-based surgery. And thanks a lot to all of them. Besides, now, in this room, I would like to ask you, after we finished one fact, raise your hand if you agree with the survey, so it will be confirmed by the audience. Okay, let's start with the first myth. All the 100% of patients with chronic obstructive rhinopathy are evaluated by systematized nasal endoscopy. The question was this: if they do 100%, B 75, C 50, D 25, E never or sometimes. The fact was, for general ENTs, they say 75% or more they do. Experts says 100% target nasal endoscopy. What does it mean? They go directly where the problem is. The three steps is when you perform the basal, the middle turbinate, and the attic and sphenoethmoidal area. Do you, when they check. You can do it with angle telescopes, and you can move the fiber to see all those areas. Do you agree with this? Please raise your hand. Okay. Does anybody do the same? Yeah? Not? Please wake up. Okay. The experts, they can do what they call preparative nasal endoscopy for skull-based surgery, and they go directly to these areas to prepare those patients for surgery. The second myth is 100% of the patients with chronic obstructive rhinopathy, do you evaluate nasal valve and vestibule? The question was this. And the fact is 75 or more of the patients are evaluated for general ENTs, and experts say 75, they do target nasal endoscopy. This is important. We have to remember that 90% of the airflow goes directly to the middle turbinate and the sphenoethmoidal recess. And this is important because sometimes the patient with sinusitis, they have valve problems and they are not evaluated. Do you agree with this, the audience? Do you do this study? Please, come on, wake up. Do you agree with this or not? Yeah, okay, this is okay. Myth number 3, they evaluate middle meatus and sphenoethmoidal recess all the time. The fact was both, 100%. So we always evaluate the middle turbinate, the middle meatus, and the sphenoethmoidal recess almost all time. I presented some pictures taken by the camera that you're going to see next to the pictures. So you're going to see with 2.7 millimeters 30 degrees and 4 millimeters 30 degrees the difference. So at the end of the presentation, we're going to see which camera do you like more. The fourth myth: everybody does cribriform and olfactory area evaluation. The fact was general ENTs, they perform 75 in the cases, and experts do always. Do you agree with this? Okay. You're very tired or sleepy. Okay. This is the area what we see in 2.7 millimeters 30 degree, and this is the difference with 4 millimeters 30 degree. Okay, the experts do as Another specification or indication for CSF leaks with 5% fluorescein. The myth number 5, Eustachian tube and Rosenmuller area are evaluated 100%. So we always see this area when we perform nasal endoscopy. Those are beautiful pictures. We like to do this always. Okay, how much of the people does basal nasal endoscopy with no medication? General ENTs do 50% of the cases. Experts does 100%. What does it mean? They do with no medication. This is very important to see the quality of the mucosa, quality of the secretions, and the anatomical variations that you can see in those cases. Besides, they can take cultures in those difficult cases. Okay? When do you perform medicated nasal endoscopy with anesthesia and vasoconstriction medication? Both groups says 100%. Do you agree with this? Yeah, okay, everybody does. Okay, this is important. When you perform with medication, you can do even an excellent evaluation. Besides, as in this case, you can do with angle telescope, even a laryngoscopy. It needs a little bit of experience, but you can do it. This is an excellent option. Okay, mucociliary clearance and olfactory function are evaluated. In which cases, okay, this is a pity. Most of the ENT says never or sometimes. So Dr. Augusto and another speaker has to work a little bit more with this. Experts do 25% of cases. The European group says 75. They like to study a little bit more those patients. You're going to see, this is the mucociliary clearance seen with no medication. And this test Dr. Siemens gave me from Zurich, Switzerland. Okay, the group does rhinometry and rhinometry. The question was, and they say no. So Dr. Naito has to work with this. He's another presenter. The group of European group and some from in Mexico, Dr. David Dogs, we perform in both cases rhinomanometry and rhinometry. This is part of the nasal function testing. Okay, 10 myths. Children's nasal endoscopy, best endoscope. NFL fibroscope 3.1 is the best. Okay, they say yes, the general doctors. Experts, they like more, after this endoscope, they use 2.7 millimeters 30 degrees. Okay, for adults in office, the fact was, no, they don't like 4 millimeters 0 degrees. They like more 4 millimeters 30 to 45 degrees. Experts, they like more, almost half and half, 2.7 millimeters 30 degrees. But all of them like angle endoscopes. Okay, the NT panendoscope is the NFL fibroscope. The fact was yes for general ENTs. Experts says 25 yes, but most of them like 2.7 millimeters 30 degrees. This is very important for people that is starting with this endoscopy. Okay, adults in postoperatory follow-up, the 13 myth. Okay, this was personal preference, but the experts, they like more 2.7 millimeters 30 degrees. This is very important to know for everybody. Myth number 4, 100% of the ENT specialists have medical image and video database to capture software. They say yes. The most used is AIDA DVD from stores. 100% of the ENT specialists registered all the nasal endoscopy. Was the question? Fact, 75% or more, they register their nasal endoscopies. The sixth myth. 100% of the ENT specialists compare CT scan with nasal endoscopy. This is a question, good question to know for Dr. Rainer. Okay, and they say yes, both groups compare nasal endoscopy with CT scan. The seventh myth, xenon 300 watts is the best light source for nasal endoscopy. Okay, the question was all those different sources, but the fact was they like, or they consider as the best nasal source, light source for endoscopy, xenon 175, xenon 300, even though they used to have more halide or halogen 250 watts light source. I did a comparison between those two lights. You're going to see with the same light cable, halide 250 versus xenon 300. Do you see the difference? You're going to see and compare LED 100 watts against xenon 300. There is a big difference. So for us, this is the ideal light source. This is important to you if you're going to buy another one. Okay, the 18th myth, 3 chips HID is the best medical camera for nasal endoscopy. Okay, and they say yes, 3 chips HD, but most of them have 3 chips digital camera, but they want to move to the next generation. You can compare, this is digital camera, this is digital camera HD. Can you see the difference between those? There is no comparison. There's a huge difference between one and the other one. So you can do even good explorations, and you can see the difference between different pathologies during the surgery or during your nasal endoscopy. Okay, 19 myth. The quality of resolution between commercial and medical monitor is the same. The question was, all those TV screens and monitors, and they say it's a personal preference, but they prefer, mostly the experts, flat LCD HD medical grade. Why this? Because even when you perform some procedures like radio frequency, or you use any electronic device, there is this interference. You see, this is the medical grade HD flat monitor, and this is just a flat monitor. At the same time, we're taking this picture. There's a big difference between one and the other one. The 20th myth, light cables last forever. Everybody thinks that, but this is not true. The fact was that most of the people says that they change every 1 to 2 years. The fact is, when the fiber optic fibers are damaged more than 20%, you're going to see those black spots. So you have to change the cable. If the covering cable is damaged, you have to change because there is a leak. The third point, do not store it with less 15 centimeters in wide in diameter. If you reduce this wind in diameter, you can break the fibers. Do not bend the fiber optic cable more than 90 degrees. If you do, you're gonna damage the fibers. And do not heat it, and use gas or cold sterilization. Okay, thank you very much. Do you agree with these all things, most of the people? Yeah? Raise your hands, please. Okay, Pedro? Okay. Thank you very much. Muito obrigado.